In Singapore, dermatology has strong historical ties with venereology. It all began in 1934, when the Tanjung Pagar Clinic opened at Nelson Road to treat venereal diseases among merchant seamen and the local population. In 1945, the government established a venereal disease treatment centre at Middle Road in the Dojin Hospital, set up in 1940 to serve the Japanese community. This was renamed the Middle Road Hospital, which over the years came to see both skin and venereal disease patients. In 1973, MRH amalgamated with Trafalgar Home for inpatient leprosy patients. Post-war Singapore saw the establishment of various clinics that treated skin, but none that were dedicated to development of the dermatological specialty. This would soon change. Appointed Medical Superintendent of MRH in 1972, Associate Professor V.S. Rajan has been credited for the accelerated development of dermatology into a specialty. The demand for dermatology increased, and by 1980, MRH became predominantly a skin hospital, seeing 70% dermatology cases and 30% STD cases. The planning for a new dermatology centre started and was approved in 1984. 4 years later, the new specialist centre, located at 1 Mandalay Road, shed its old name and association and began operations as the National Skin Centre, or NSC for short. NSC's opening on 1st November 1988 marked a new chapter in Singapore's dermatological history. It was the first public healthcare institution restructured during the government's hospital reform drive in the mid-1980s. A visionary administrative leader, Dr. Kwa Soon Bee, served as the first chairman of NSC from 1988 to 1992, fostering the growth of dermatological subspecialties and training initiatives. Professor Chan Heng Leong, an inspiring leader in dermatology, assumed the role of the Director of Academic Affairs for National Skin Centre in 1988. The establishment of NSC also marked the physical separation of service localities for dermatology and venereology, and in 1991, MOH commissioned NSC to run its sexually transmitted diseases programs at the new Department of STD Control Clinic, DSC, at Kelantan Lane. As the demand for its services grew, NSC embarked on a journey of expansion. NSC has successfully positioned itself as a specialist centre for a wide array of skin-related concerns for patients. At the point of its establishment, NSC started with 8 subspecialty clinics. With the growth in capabilities and capacity, these subspecialty clinics have progressed significantly. As one of NSC's earliest subspecialty clinics, the Drug Eruption Clinic attends to patients who are referred for evaluation and management of possible or confirmed drug-induced adverse skin reactions. From skin prick tests and patch tests to systemic drug provocation tests, our nurses administer them with utmost care and diligence to ensure patients are evaluated accurately and safely. The phototherapy clinic, a mainstay for many patients of NSC, has been in existence since the days of MRH. In NSC, this clinic has flourished with the addition of new technology and equipment over the years. Today, NSC has one of the largest fleet of phototherapy devices that cater for diverse treatment modalities. The newest addition is the Ultraviolet A1, UVA1 machine, which reduces treatment time for patients with extensive affected areas. The NSC Eczema Clinic was set up to manage the more complex cases of eczema, while deepening our expertise through epidemiological research and clinical studies. The clinic would formally adopt a team-based care model. Comprising physicians, clinical pharmacists, advanced practice nurses, and medical social workers, this team-based care model provides structured and coordinated care for moderate to severe eczema patients. Merging the collagen and bullous clinics from MRH, the immunodermatology subspecialty started in NSC in the late 2000s. Taking over the baton from earlier generations of experts, the immunodermatology team at NSC helped to uncover silent agents, assisting patients in their long drawn-out battle with immune-mediated skin disorders. Whether through adopting sustainable care models or new technology, NSC is committed to innovating to bring about improved outcomes. In 2016, NSC launched an award-winning tele-collaboration service with NHG Polyclinics. This gave primary care providers remote and quick access to dermatology specialists, translating to improved right sighting and appointment wait times. With the COVID-19 pandemic, our teledermatology services have evolved and expanded to also include e-consults with patients, especially those who are elderly and frail, on immunosuppressive therapy or who have scheduling difficulties. As the main dermatology training center in Singapore, NSC plays a pivotal role in dermatology education of all medical learners, from undergraduates and specialists to qualified practitioners. The Advanced Specialist Training Program took root in 1991 as a form of apprenticeship-style medical training for specialists. It would then evolve to the Dermatology Senior Residency Program in 2013 to bring a more structured program with outcome-based training. The Dermatology Senior Residency Program is a cross-cluster training program with NSC as the main training site and dermatology units of CGH, SGH and NUH as participating sites. The 3-year program provides a continuous base of active, participatory study and experience in dermatology and rotation through the various core dermatological subspecialties. In response to the demand for improved dermatological knowledge among family physicians treating skin diseases, the Division of Graduate Medical Studies, Yong Lu Lin School of Medicine, National University of Singapore, and the National Skin Centre jointly launched the Graduate Diploma in Family Practice Dermatology program in 1998. This initiative includes various courses aimed at enhancing the dermatological knowledge and skills of family physicians, focusing on primary care management of common skin conditions. NSC is committed to education for both the medical community and members of the public. It shares its expertise and insights on the latest dermatological advances through seminars and conferences. Its flagship medical conference, inaugurated in 1995, is highly regarded among local and regional delegates for its academically enriching and insightful content. Several textbooks and atlases on dermatology and venereology published by NSC are a valuable resource to dermatologists managing skin of Asian descent. NSC also runs regular public forums to raise awareness about skin health and prevention. As NSC matures in clinical care and education, it is committed to building research as a pillar at the core of its triple mission, alongside clinical care and education. Since its founding in 1990, the Research Department has expanded and collaborated with research and academic institutions to advance dermatological knowledge and treatment options. A significant milestone in skin research in Singapore was the establishment of the Skin Research Institute of Singapore, SRIS, in 2013 in partnership between A-STAR, Nanyang Technological University, NTU, and National Healthcare Group, NHG. NSC, as part of the National Healthcare Group, plays a key role as the clinical partner in the tripartite collaboration. NSC's work in research has translated to mainstream clinical services to improve patient outcomes. In 2005, NSC introduced the first cultured melanocyte grafting for stable vitiligo patients, a more cosmetically desirable technique than the initial punch grafting. This was the result of years of research into new treatment methods for vitiligo patients. In 2015, NSC began researching high-definition optical coherence tomography (HD-OCT) and reflectance confocal microscopy (RCM) imaging devices. NSC became the first in the region to implement RCM as a clinical service in 2021, providing patients with a less invasive and quicker way of diagnosing skin cancer. NSC's research and innovation efforts also plugged a gap in the market for a product that is safe, with rapid itch relief and skin barrier restoration. With the growth in demand for patient services and a concomitant need for a larger pool of qualified specialists and new research developments, the National Skin Centre would eventually find the need to expand its services and facilities. Thus, plans to expand to a new building were set in motion. NSC's new and larger home would sit within the ultimate plan of Health City Novena, comprising of the different institutions surrounding Tan Tock Seng Hospital. This visionary healthcare hub connects multiple institutions, offering comprehensive care, education and research. In 2023, the new NSC opened its doors to provide advanced patient care, enhanced research and new capabilities to meet evolving healthcare needs and better serve the population of Singapore. As we forge ahead, we continue to honor those who came before us to build the foundations of our institution. NSC continues to push the frontiers to achieve excellence in dermatology and provide seamless care within a one-stop center. It strives to be a beacon for world-class dermatological care, education and research, a center of choice for our patients, staff and partners in advancing skin health for current and future generations.